Namaste, everyone. I'm Jyotsna Rao, the manager of Indian Care, and I would like to begin by acknowledging the traditional custodians of the lands and the waters on which I work, live, and play, which is the lands of the Wurundjeri and the Bunurong people of the Kulin Nation. I pay my respect to their elders, past, present, and emerging. आज के इस इंफॉर्मेशन सेशन में उपस्थित इंडियन सीनियर्स को भी मेरा नमस्कार. And thank you, Shivani. This is a great collaboration between Indian Care and Australia-India Society Victoria and ECCV, who have very kindly agreed to host this session on vaccine information for us. And I am delighted to also share that we will, share this recording once we get it with our community members. So it's, even though we have limited people joining in, there will be many more watching it. So thank you again. Over to you, Shivani.
Thank you, Jyotsna. And I would just introduce ECCV to all of us. Ethnic Communities Council of Victoria, ECCV, was established in 1974. Since then, ECCV remains key advocate and to culturally diverse communities. ECCV is a member-driven peak body, a voice of multicultural Victoria, and a lobby to state government on behalf of multicultural communities. ECCV's mission is to work to ensure that we remain driven peak body committed to empower our multicultural community. Thank you, Rahel. And then there are some housekeeping rules that we already know while being Zoom on most of our day's time. So just keep yourself on mute if you're not speaking, and if you have your phone closer to you, if you can keep it on silent. And then at the end of the session, we will have a question and answer session. If you have some burning questions coming to your mind and you feel that you will forget, you can put those questions in the chat box and we will pick them from the chat box when it's question and answer session. And at the same time, I would like to say that session is going to be delivered by Mohammed in English, but if at any point we need to translate it in Hindi or Punjabi, any information that is needed to be translated, then I'm there. I'm here to translate the information provided by Mohammed in Hindi and Punjabi. Thank you, Rahel. And I would also like to say a few words about our community, ECCV's community outreach program. In ECCV's community outreach program, we are a team of bilingual outreach workers speaking Hindi, Punjabi, Turkish, Kurdish, Somali, Arabic, and English. Our aim is to reach multicultural communities to provide information session in a timely manner to promote COVID-19 vaccine rollout and address any vaccine hesitancy issues. And in that, we just really want to thank you, our partners, Department of Health, Indian Care, Victoria, India Society of Victoria. Thank you, Rahel. And these are the few topics that you would be hoping to hear during the presentation session. And now I would like to introduce the most decorated presenter we have ever seen, Mr. Mohammed Mehrdin. He is the head of Priority Communities Engagement in COVID-19 Vaccination Program. He is a microbiologist and a professional member of Australian Society of Microbiology. He has also been an academic in Department of Microbiology at Monash University for over 20 years. He is originally from Sri Lanka and has been immediate past president of Islamic Council of Victoria and is also the current deputy chair of Faith Communities Council of Victoria. He is current Victorian Multicultural Commissioner. He is a recipient of Order of Australia and is a current Justice of Peace. Very decorated person, Mohammed. I would like to invite you to share your wealth of knowledge with us. Thank you, Mohammed. Over to you. Mohammed, you are on mute. Mohammed, you are on mute.
Sorry. Thank you, Shivani, and thank you, Joseph, for all the warm welcome and for organizing this event. And I would like to begin by acknowledging the traditional owners of the land we meet on and pay my respects to the elders, both past, present, and emerging. And also the elders in this gathering, we pay our respects to everyone. I think that's an important aspect, and you are being our leaders and we follow in your footsteps as well. I'll begin by just talking a little about COVID itself. I think just to remind ourselves, we know what COVID is, but we know how the virus spreads very easily by droplets of saliva or discharge from the nose. And this is why with any respiratory illness, we always ask people to cover their nose or mouth when they cough or sneeze, because one of the simplest ways of spreading this disease is when we cough or sneeze, we release a lot of particles if we are infected, and that gets into the environment and that can be picked up by a lot of people. So this is why masks have been made mandatory for everyone, whether you are inside, when you're going inside to any building, or at work, or even when you're outside, to wear a mask. Now, we all know that this virus gets spread through the respiratory system, and it takes sometimes 2 to 14 days before people see some of the symptoms. So you could get infected on day 1 and you might start showing symptoms in day 8, day 9. So it's important to understand that during this period where you're infected, you're also very infectious. So what we always ask people is, if you have been to a tier 1 site, so a tier 1 site is where an infected person has been to. So you, by that thing of going to a tier 1 site, become what is referred to as a primary close contact. So every single person who is a primary close contact who has been to a tier 1 site, or what we refer to as a hotspot, must test and quarantine for 14 days. It might be that you are not infected at all, but the precaution is that if you are infected, we are trying to contain your movements so that you don't spread the virus to other people. So this is why it is important to get tested on day 1. And sometimes on day 1 or day 2, you might not show any positive result because you'll be asymptomatic at that stage, and the virus will be building up in your system as well. So this is why that 14-day period is very important in order to sort of contain the spread. Now, generally, it can be a very mild illness for some, and this is why some people look at it, it's just like a common flu or just any other illness. But sometimes it can get very severe where your oxygen levels, you have very low oxygen levels. Now, what happens is generally when you get infected is your immune system gets activated. It can get overactivated and cause these problems as well. So you could end up in hospital because you need oxygen. So you'll be in hospital. And if it gets much more severe, you're going to end up in the ICU and also having to be on a ventilator, or it can also cause death. We know worldwide there's been over 4.8 million people who have died. So some of the symptoms that is related to COVID is a sore throat, cough, runny nose, shortness of breath, fever, and chills. And if you look at most of these symptoms, they're very similar to your common flu, or even some people who might be suffering with hay fever as well. The loss of smell or taste is very identical for COVID. So if you have any of these symptoms, don't assume that you just have the common cold or flu, but get tested, because this is what is happening today, and we are seeing the high numbers because people are just taking it for granted. People are not getting tested. People are waiting until it's day 5, day 6, when they start to really feel sick to go and test it. In the meantime, they've been into all the shopping complexes everywhere else, gone to visit other people, and they are unfortunately infecting a lot of people as well. So what we ask you is, it's not just vaccination alone that is the answer to stop the spread of this disease or even stop people getting infected. It is the COVID safe behavior. We refer to as COVID safe behavior. It is wearing a mask. In most cases, wherever you go, it's just keeping the social distancing. Remember, the social distancing came way back last year. We are again trying to reaffirm that it's important for people to maintain, especially when they are in shopping centers. We are seeing some of these outbreaks occurring in shopping centers where people have gone. We are asking you to wash your hands and use hand sanitizers. Especially, it's ideal to keep a little hand sanitizer in your bag or keep it in the car. When you go out anywhere, when you come back, just make sure you wash your hands thoroughly. Because generally it's seen that human nature is to touch our nose, eyes, or mouth every 3 minutes. It seems to be a subconscious reflex action in us. And so if you were to touch a surface where it's contaminated and you touch your nose or mouth, you could easily get infected. Another aspect is to make sure you QR code, because the QR coding is to be allow the contact tracers. Lots of people in the community are working, young people have been employed as contact tracers. So when you go to a site, and if you are an infected person, you go to a site and you check in with your QR code. So they know that you have been there. They can also look at other people who have been there during the time you have been there. They will contact them, ask them to get tested and quarantined. So it's important, this QR coding is not to police anyone, as some people think it is. It is to help check and also reach out to people who might be potentially be infected or been exposed to an infected site. The information that is logged on the QR code, 28 days after you QR code, it totally disappears. It's destroyed. It's not kept forever and ever. So if you're feeling unwell, you must stay at home. As I mentioned, some of the symptoms. So you get tested and stay at home. Now, the state government, for people who are on casual work, like who depend on daily wages, there is some support, financial support being offered. Like people who quarantine for a short period, like for just 2 or 3 days, there's about $450 as supplementary income source. If you are to quarantine for 14 days, there is $1,500 offered. So what you need to do is apply to Centrelink, show proof that you have had a loss of income, that you have been unable to go to work, and you had a loss of income, and you will be eligible for that money. Vaccination is the other aspect of it that I will talk more about it now. And it's also important to advise people to check on the website for exposure sites. That information every 2 hours is updated. You see new sites coming up because there's been somebody who's infected who's been to somewhere or someplace. So it's important for us to check this and keep sure that we keep a track of it. Now, the federal government made a decision that the testing and vaccination is free to everyone, whether you be a citizen, whether you be a resident, whether you be an international tourist or traveler who's coming to Australia as a guest. We are from the CAL community. It's very common for us to have people from overseas. They might have come before this COVID outbreak, and they might be still with us as well. So they, and even international students and refugees, every single person is eligible to get tested and vaccinated free of cost. You don't need to have a visa. You don't need to show a Medicare card. You can still get tested and vaccinated if you don't have any of these documents. Now, just to give you some update, as of today, we have in Australia, 76% of the population has had one dose, nearly 53% has had the second dose. Today, we have over 20,096 active cases of COVID in Australia. Around 1,551 are in hospital, with 297 in ICU and 177 on ventilators. Sadly, we have lost 1,256. Now, I just want to mention about ICU. Generally, into the ICU goes patients who have undergone major heart surgery or had a big heart attack. They will be in the ICU. Generally, people are there for a day or 2 or 3 days or 4 days maximum, and then they are taken to the other wards. Unfortunately, with COVID, we are seeing these people who are infected with COVID and who end up in ICU being there for over 1-2 months. And so some of the hospitals, and this morning we were told one of the hospitals in the northern suburb, the ICU is 100% full. ICU beds are 100% full with COVID patients. They cannot take a single extra patient who would normally be going into this area. So you can see the burden and the weightage on these ICUs at the moment because of COVID. In Victoria, we have over 78%, which is, you can see, higher than the national average. And we have second dose, which is around 48. We have 9,261 cases. So if you compare the national numbers to ours, we are nearly 50% of the total numbers. And yes, this morning we got the information that 849 people have been infected since yesterday. Now, in Victoria, there's, as I said, 9,261 cases. 375 people are in hospitals. Of that, 81 in the ICU and 61 are on ventilators. And we had one death. We had yesterday, but we had 4 deaths announced this morning. So total from the 1st of September to 28th of September, we have lost 29 people. It's a lot. Like when you compare in the past, we were not losing, we were losing maybe one, or we didn't lose anyone for a long period of time. And all of a sudden, with this particular outbreak, we have lost 29 people already. 85% of the people in hospitals are unvaccinated. 13% has only had 1 dose, and there's only 3 people who are fully vaccinated. And these fully vaccinated people also have other comorbidities, and that might also be a reason that they are also in hospital as well. Now, I just wanted to show you these stats, I think, just to give you an idea. This is from yesterday's data. Although we have 8,538 cases, yesterday we have gone up past 9,000. You can see Hume has the highest level, 3,089 cases. Basically, nearly 45% of the total active cases in Victoria are in Hume. Then you have Moreland, and then you come down, you have KC, and Dandenong we are seeing. I have been putting this data up every day for the last 10 days, and every single day it has gone up. Not a single day has this number gone down. It's good news is every day, again, this number, the percentages of people vaccinated has been going up. You can see now, although we might have first dose, we are on the cusp of getting ourselves to that 80% over the next day or two. With second dose, we are very much lagging behind of what we expect to be seeing now. So it's important to sort of encourage people to go and get the second dose, because it's only the second dose that will take you up to over 90% of immunity as well. So today we have 3 vaccinations available to you. So you have Vaxzevria, which most of us know as AstraZeneca. It's given in 181 countries at the moment. We have Pfizer, which is the commercial term is Comirnaty. It is given in 137 countries. And since this month, we are also starting to give Moderna, or referred to as Pivax. That's been given in 75 countries. And all 3 vaccinations, all 3 vaccines are very effective. So AstraZeneca, which is given to people over 60, it's a traditional vaccine, like we were discussing about our BCG vaccine and other vaccines we have got. It's like the traditional vaccine that we get, where you use a different strain or different non-pathogenic strain. You incorporate the genetic material and you vaccinate to build up the antibodies. Generally, this is given 4 to 12 weeks apart. At the moment, it's being given 6 weeks apart because we are in an outbreak mode. With Pfizer and Moderna, they're both similar mechanisms. They're both mRNA vaccines. So what happens here is the genetic material to produce the spike protein is incorporated in various components are added, and it's vaccinated. And all 3 vaccines, what they do is produce the spike proteins in our system. So the moment the spike proteins are produced, your body reacts and produces, your immune system reacts and produces the antibodies. And they basically destroy all the spike proteins. Now, then this information and ability to produce the spike protein, the antibodies, then is retained in your brain memory. And when you do get infected, it activates and produces the antibody to fight against the virus. That's the mechanism of how these vaccines work. Now, Pfizer is offered these days 6 weeks apart because of the supply issue. As we increase supply, we will start reducing it to the normal 3 weeks that we were doing in the past. With Moderna is given 4 weeks apart. And again, they're very effective vaccines. Like Moderna is mostly given in the USA. Majority of people have got Moderna vaccine as well. They are all being offered at your GPs, at your state-run vaccination clinic. Moderna is also, Moderna and Pfizer and all are also offered at pharmacies. So if you are unable to book a vaccination appointment at a GP clinic or even the mass vaccination site, you can book an appointment with the pharmacist. There's this link. I will share these links with you all. You can go into this link and look at what's the closest pharmacy and get an appointment very easily. Now, again, one of the key things for people who don't have a Medicare card, your GPs will require you to have a Medicare card because normally they would use the Medicare card to charge you. So we don't get charged directly, it's in the Medicare card. But for people who don't have a Medicare card, unless they're prepared to pay that consultation fee, they can either go to a pharmacist or go to a mass vac site to get vaccinated. So with the virus, generally one of the properties of virus is to undergo change. We see that even with our flu virus. The flu virus every year changes. This is why the flu vaccine every year has new, it targets new variants as well. So same thing with this particular virus, the COVID virus, it has undergone changes. And these changes has resulted in some of the new strains becoming more virulent. In the past, they labeled it in where it occurred in a country because generally people who understand viruses have to grow in a host. So for this particular COVID virus, humans are the host. So what happens is that when a human gets infected, it can undergo change in the human being. And that's how it comes out with a new variant strain. So it was very confusing to a lot of people. And we know, unfortunately, because they were labeling this by the country where it was coming from, people then were targeting those particular communities. So what the WHO did was relabel them with the Greek alphabets. So today of concern is our Alpha and Delta strain. The fourth lockdown we had was Alpha. This third wave that we are going through is the Delta strain. Now the Delta strain is found to be more virulent, it's more contagious, it spreads much faster. Like remember last year when we were talking about infections, if one person in the house was infected, he or she could quarantine themselves in a room, just get provided with all their meals and all that, and the rest of the family was not infected. But with this Delta strain, if one person gets infected, most probably the whole family gets infected. And this is why our numbers are going up as well. And if your household is a large household, so you can imagine if there's a family of 10 people, within a few days, all 10 will be infected. So this is why it is most important that we take precautions early on and avoid getting infected as well. And we also find with the Delta strain, it's causing more hospitalization and it's also affecting young people as well. I just wanted to show you this. This is from yesterday's data. You can see the number of active cases currently. We spoke about the 8,000 odd. This is yesterday's 8,000 odd. If you look at the number of young children who are infected, males 581, females about 518, 10 to 19, 697, 792. So if you look at the stats, 53% of those infected at the moment are under the age of 30. 71% is, if you take the total figure, is under the age of 40. So you can see more young people are getting affected than in the earlier strains where the elderly people are getting infected. So it is important that we try and get people vaccinated as soon as possible. Now, the good news is our vaccines are really good. All three vaccines, Pfizer, AstraZeneca, and Moderna, are effective to protect people from severe disease, whether it be going into hospital or ending up in the ICU or even avoiding death to a certain extent. We say that with the first dose, you can build up to 87% for both Alpha and Delta strain. With the second dose, you can go beyond 90% in both strains as well. So it is important for us to seriously make sure that we get both doses, not just one dose, because that's how we can prevent many people from falling seriously ill. Now, like all vaccines can cause some side effects. It's very common that you could have pain, you could have tiredness, people will have headaches, some people will have aches, and some people, a lower level of people will have fever. Now, these are very common side effects, and with Pfizer and Moderna, is generally seen after the second dose. With the case of Vaccinated, it is seen after the first dose. But sometimes it can occur the other way around. But like to just let you know, I had AstraZeneca, I had Vaccinated. I was planning, I bought painkillers, I bought everything under the sun thinking I'm going to get some of these side effects. I had no side effects. So some people will show no side effects. And even my niece who had Pfizer 2-3 days ago, she had a second dose. She had no side effects. I was telling her, just keep some Advil and all ready if you feel any of the symptoms. So she had no side effects even after the second dose. So it can vary from person to person as well. So one of the key things I wanted to touch on was the anaphylaxis reaction. This is very rare. You can see it's 1 per million for Vaccinated, or roughly about 4.7 per million doses for Pfizer. This is like a very strong allergic reaction. And this generally occurs in the first 15 minutes. And if you were to look at some of the side symptoms, so it'll be like difficult to breathe, swelling of your face and throat, a fast heartbeat, a rash like hives appearing on your body, feeling dizzy and weakness as well. And generally this occurs in the first 15 minutes. And this is why when you go to get vaccinated, it's important you remain on the site for 15 minutes under observation. Even if you go to a drive-in site, please do not drive until that 15 minutes is over and the medical person tells you you can leave. Because if you do get this reaction, there are people there to help and treat you as well. So 15 minutes is very important after vaccination. Now, this is, I think, a lot of people, especially people over 60, would also be concerned about. It's the blood clots which are linked to AstraZeneca. Now, this is referred to as thrombosis with thrombocytopenia syndrome, or TTS, where most people know it as TTS. Again, this is a very rare occurrence in people. It's not a common thing that happens. And today we are able to identify the symptoms. It is normally occurring between the 4 to 30 days. Normally after 2 weeks, you can see if people start having chest pain, swelling in your legs, persistent abdominal pain, tiny blood spots, or even shortness of breath or neurological symptoms, that you need to get yourself to a doctor as soon as possible, because it can be treated and you will recover from these symptoms as well. Now, just for your information, it's good to know that COVID itself can cause blood clots. And the chances of getting blood clots due to COVID is 16.5%, compared to getting clots due to AstraZeneca, which is 0.0004%. So if you weigh the positive aspect of getting vaccinated compared to getting clots due to COVID, the vaccination far exceeds the positive nature of it. In Australia, over 11 million doses of AstraZeneca have been given. And we have had about 130 odd cases. We have only lost, sadly, 8 people have died, 6 women and 2 men. Most of the people were below the age of 50. We had 1 or 2 cases of the elderly, but it affected mostly the young people, younger people below 50. Now, with Pfizer and Moderna, these things could happen. It's referred to as myocarditis or pericarditis. Now, just for your information, myocarditis or pericarditis can also occur in young people between the ages of 12 to 25. It sometimes it can manifest itself without vaccination. So with the vaccination, there have been cases also observed, and all of these people have been treated. Normally, this happens in the first 10 days of after vaccination: chest pain, pressure or discomfort, shortness of breath, irregular heartbeat, pain, breathing, and also fainting. So if you have any of these symptoms, you get yourself to the doctors and get treated. Again, to assure everyone, there's not been worldwide, there's not been a single death due to the vaccination and people who develop myocarditis or pericarditis. All have recovered. Now, I want to touch on this important factor. I think when you talk to a lot of young women, and this is important, generally when a woman gets pregnant, her immune system drops. So she becomes somewhat a bit immunocompromised. So if they get infected with COVID, it can cause, there's a risk of 5 times greater getting into hospital, 2 to 3 times in being in the ICU. or even 3 times having to be on a ventilator. So also with during the pregnancy, there's risk of complications. So 1.5 times of being born premature, or increased risk 3 times of the baby having to go into the ICU as well. So today the vaccination that is offered to most pregnant women, they talk to their doctors and gynos, and they make the decision. Pfizer is the preferred vaccine. You can get it anytime during your pregnancy. And people who are planning to get pregnant as well, you don't need to delay getting the vaccine, or after getting pregnant, you don't need to delay getting the vaccine. There's lots of studies from the USA that shown over 3,000 odd women took the vaccine and got pregnant. Also, it has been shown that the vaccine provides indirect protection to the babies by transferring antibodies to the placenta or through breast milk for breastfeeding women as well. And there's lots of paper. There's a recent paper that came out showing the antibodies present in the placenta, in the umbilical cord of the newborn baby as well. So today we have over 60 vaccination sites across Melbourne that is run by the state. You can ring the number 1-800. We know people have had problems of booking online, but what I would strongly advise is you can also make your appointments to your GPs. In some cases, you can also have walk-in, where you go onto the site and get vaccinated. You don't need to make bookings. So you will find that this will be the trend as we move forward. From next week, many pop-up sites will offer this walk-in advantage, that you can go and get vaccinated. You might have to stay a little longer because there might be queues there, but it is that ability to get vaccinated without having to go through some of the hassles that people have faced. Also, you can book through your pharmacies to get vaccinated. So we are strongly advising people to look at alternates. There are 3 different pathways to go for vaccination. One is a state run, one is your GP clinics, and the other is the pharmacies. So if for some reason there are people who, especially the elderly, who are unable to, they're not mobile to get out of the house and they have issues, they can contact the disability liaison officers. I'll share these forms and all that you can apply, and they can organize for them to be vaccinated at home as well. Now, a thing to share with people is that if you have already made your booking to get vaccinated, but then you feel unwell, you have been to a hotspot, you are, sorry, you're considered to be a close contact and quarantining, or you're waiting for results, you must not go to the must not go to the site. It's best to reschedule your appointment once you have recovered as well. What we are also trying to advocate is, if you are infected, please do not go to the vaccination site or to GP clinic if you fall into any of those categories, because what happens is, if you do go to one of those sites because you are infected, what happens is that clinic will be shut down, that place will be shut down. All the staff, including the doctors and nurses who are generally vaccinating, will have to go into quarantine for 2 weeks. So what happens is, we are then running short of people to do the necessary work of of vaccinating people. So if you know of people, please advise them if they have any symptoms to get tested, and if they are quarantining, to finish the quarantining period and then get vaccinated. But if they are ill, they must contact the hospital and try and get to the hospital. Do not stay at home and try to treat yourself as you get worse. Sometimes we have seen, not only in New South Wales, but even in Victoria, where people have died, they have not got tested, they have died at home. And it is only after the postmortem was done that they found out that these people were sick with COVID. And also what happened then, we had to then test the rest of the family. And in one case, 5 of them had to be rushed into hospital as well to give them some sort of help as well. So vaccines are effective. They reduce the spreading of the disease. It's important to get both doses. They also prevent you from getting seriously ill. One thing, again, there's a lot of misinformation out there that the vaccine can make you sick, but we know, most of us in this particular forum, I know, have all been vaccinated. We are used to vaccines. So this is not something new to us. So it's also shown that scientifically that the virus is unable to mutate in people who have been vaccinated, which is a good thing, because this is not going to stop. We have about 13 different strains. It is going to continue to mutate as well. We are seeing new strains coming out. So For us to be one step ahead, getting vaccinated will prevent these new strains from rising as well. We know with vaccines, it's not a quick fix. It's not going to occur within a day or two. It takes roughly about 2 to 3 weeks before your immunity kickstarts after the first dose. So you will start building up about 70 to 70% immunity, but that will take 2 to 3 weeks. So it's important to get vaccinated as soon as possible, not wait until somebody falls sick in your family or somebody in your neighborhood is sick before you think you must get vaccinated. If you're already infected, the vaccine is not going to work because we know vaccines are not a treatment, vaccines are not a cure, it is a preventative measure. If you have had COVID, generally it is referred that you stay for 6 months before you get vaccinated. But in today's context, because we are in an outbreak mode and we want people to build up their immunity, it is suggested that once you finish your infection COVID period, that within a few weeks, you get vaccinated and get it done as well. So this is, I think, especially for people from overseas and who travel, especially for people who from the subcontinent. Lots of students have asked this question. If you have received a first dose of a COVID vaccine that is available in Australia, whether it be Moderna, Pfizer, or AstraZeneca, you can get your second dose of the same vaccine here. If you have had a first dose of vaccine, which has been approved by WHO, which are the other vaccines, there's a whole heap of vaccines that WHO has approved. You can go to the website and have a look at them. If you have had any of those doses, you will be given a second dose of an equivalent vaccine based on your age group as a second dose. People who are returning to Australia from countries where the vaccines are not approved by WHO at all will have to have both doses in Australia. So this is something for people to note. They can get this done as well. Now, once you finished your vaccination, you can get your immunization certificate. This will be, I think, requirement as we move forward. Like we were just talking about Melbourne Uni, making it mandatory for all staff, students after November 5th or something like that, that they need to be fully vaccinated. So, or at least have one dose. So this would be where you have that information sitting in your phone. You don't need to be carrying a paper or something like that. So this would be one way of getting. You can go to MyGov and you can download your vaccination certificate from there. So these are some of the websites, and thank you very much. I'm happy to take any questions now.
Thank you so much, Mohammed. I can see Jyotsna's hand up, and Jyotsna, would you like to ask first, because I saw your hand was up first?
I would like the seniors, इंद्रजीत अंकल और आंटी अतरजीत आंटी को पूछने दो. हाँ, आप पूछ लो पहले.
Shall I go first or
yes, please, Indrajit ji.
Okay. What I like to know is, I've already had both of my injections. Now, is there a process that, say, they're talking about a booster, that is there a testing mechanism to test you out your immunity first before they decide whether you need a booster or not?
So thank you very much for that question. It's a really good question. Like if you see what's happening in the USA, UK, and all of them, they are starting, FDA has already approved booster shots for people over 65, I think, and this is where we will move forward. In Australia, still the booster shots have not been approved by ATAGI, which is that health body that is supervising it. What research is showing that the vaccine memory, it's because it sits in your memory. It's not the antibodies that are remaining in your body. It's the memory it's what is in the memory to, act and produce the antibodies. So that is, as time goes by, that wanes, and they've seen that 9 months to 12 months, that's the time period. So I have a strong feeling we will also go down that booster shot, but because we only started vaccinating somewhere in February compared to other countries where they were vaccinating last year. So that's why now it's coming to nearly a 1 year period before they're starting to give they're looking at their booster shot. I think this will be the same for Australia. I don't think they're going to be testing you for antibodies, because unless you are, with all our vaccines, it's not the it's seroconverting is yes, but it's not the antibodies are not circulating in our body and that they will be able to get from you. It will be that memory, what's in the memory. So what they will work out is after a certain period, maybe 9 to 12 months, you will be given a booster shot. And I think ATAGI is starting to look at that. But at this moment, we are trying to get everyone vaccinated. We are still not even first dose. We are not complete. So until people all get the second dose, we might be waiting a little time, but I don't think not that long. I think early mid-year next year, we will start, I think.
I mean, there would be no way of telling that your immunity is down, would it? Or unless you feel lethargic or anything like that.
Unless, yeah, it'll be impossible to test because, antibodies, generally, like, how when you, this is me as a microbiologist talking, like generally, like when you have a recent infection, your antibody levels are very high. And as it goes down, your antibody levels drop as well. So like what will happen is initially, and that's how they look at seroconversion when they give the vaccination, maybe in a few days or 2 weeks time, they can see what levels of antibodies you produce. But that as time goes, that will drop as well.
Thank you.
Yes, Atrajit ji, you can ask your question.
Okay. My question is regarding the Centrelink payment. You told that if somebody is having quarantine like a 14 days, they can have 1,000 something. So sometime like one of my friends, she's having quarantine twice. So is she eligible for as many times she is going to get quarantine or only once?
She's not eligible unless she has loss of income. She has to prove that she has had loss of income, and she has to apply to Centrelink, and Centrelink will then evaluate her case and see that she has had a loss of income, and that's the reason. So it will be up to the Centrelink to make the decision.
Okay, thank you.
Can I ask something?
Yes, Ramesh ji, please go ahead.
I got 2-3 questions, if you don't mind.
Yes, go ahead.
My first question is, mostly I've seen they are giving Pfizer and Moderna only 12 to 59. Why can't they give to above 60 years old people?
Yeah. Thank you. This has been a very important question that many people have asked. The reason that they sort of were not giving to people over 60 unless they had some health issues. They have been giving over 60 as well. Like if you go to the website, there's a list of health issues that people can then get Pfizer or Moderna. Because we are short of supply, they will try to get as many young people as well. And you can see today with this Delta strain, it's really targeting people under 50 a lot. The percentages wise we are seeing of people who are sick is in the younger. So they want to get most people vaccinated. That's why they are holding off from giving Moderna and Pfizer to people over 60, but things can change I think if we get more supply and more resources of these vaccines, because the vaccines come from the federal government. The state governments cannot purchase vaccines from overseas. It only can be purchased by the federal government, and they then dole out, a certain amount of vaccines to each state. So, but in some other states where the population is low, like we know in Queens, I think South Australia, Western Australia, and some other places, they're already starting to give people over 60 Pfizer and Moderna as well. So it might come that we will also start giving, but at this stage, because of that supply issue, that's one of the limiting factors.
Okay, my next question is, when do you start giving vaccination from 5 to 12 years old children?
Okay, the research is still being done. There's no hardcore still, because even Professor Majid Anshan spoke about it. There's work being done in the USA about children, but they have not officially started vaccinating children in any part of the world under 12. It might be that it will be available, but what they're seeing is, whatever the studies that have come out is, that the children's antibody levels are very fast, they develop. So maybe the dosage might have to be altered, not the same dose that the older people have been given, but until all the studies are done. And one thing with our ATAGI, which is the body that of medical professionals and health experts, they are very careful about approving any treatment to people. Even when the vaccines were to be approved, it took them a long time. They go through everything. They want to see the latest research, the latest stats and all that. So they're very careful to make sure that whatever is offered to Australians is safe and it'll protect people and not cause harm. So we are still to wait for that decision. Yeah.
My next question is, can mRNA COVID-19 vaccine pass on high level of antibodies to their unborn baby for the pregnant lady?
We don't know about I do not know about high level, but research is showing, papers are showing that the vaccine is, vaccinated mothers are passing antibodies to the fetus through the placenta. And the studies that have been shown, there's a recent paper that came out 3 days ago about them finding antibodies even in the placenta, in the umbilical cord as well. So.
My last question is, after the second dose, if any side effect appears, and for how many days one has to wait to go to the GP?
So flu would be, so flu would be generally, if you get it, especially after Pfizer, some people get the flu and they feel really tired for about 2 to 3 days. So you would observe for about 2 to 3 days. And if things continue and get worse, then you would obviously ring the GP and say that whoever you got your vaccine, ring your GP and make an appointment to see them as soon as possible, I think. Or if you feel really sick and like in the sense is you think it's maybe life-threatening, you would reach out to your GP, I think, to get some consultation.
Thank you. Thank you so much.
Can I ask one question?
Go ahead.
Yes, go for it, Abdi.
Yeah. Hi, Dr. Mohammed. Thank you very much. Some of the communities worry about the vaccine ingredients. So is the vaccine ethically and religiously safe?
Yeah, the vaccines, there are a list of ingredients that are in the vaccines, and most people have approved the vaccines to be used. There's no animal products or okay, I think this was a lot of studies, lot of information was about AstraZeneca and the original work done on fetal aborted tissue and all those things. Now, if you look at the research that was there, these aborted tissues were from 1961, and it was what they've used was not the, they've done so much of stem cell research. We have done a lot of stem cell research where we have developed skin grafting, and also it's generations and generations in the lab. They have sort of created all these new generations of these cells, and those cells were used because their fetal cells are the best cells, which helps to develop viruses, because viruses need the host to grow. So initially, when you're targeting and doing all your research, you need to use the virus cells. You need to grow it, and the growth will only take place in human cells, and the fetal cells were whatever they had. So the fetus was not aborted for research, right? What was used subsequently, it was not the 1961 cells that were used. It was how you maintain those cells by regeneration through stem cell research that was used. So I think people got confused with that. People looked at it from a religious point. Oh, they used fetal cells, aborted cells. The word abortion was highly, made a big issue. And people then moved on once they realized the scientific base and the evidence under that.
Thank you.
How about your question, Jyotsna?
Yeah, so I just wanted to comment on what Ramesh Uncle had also asked. I think about when would you go to the GP. So I think if you have anything to do with shortness of breath, or that you are feeling exhausted for a reason that you can't understand, then I personally would suggest that you go immediately or call the helpline. And with what Mohammad Bhai just said about it. So subsequent cloning of the cell line actually takes away the start of that cell line. So it's no longer from that aborted fetus. It is synthetically done in the lab, for want of a better word. So I just thought I would add that.
Thanks. Thanks for that.
Yeah, I've had so many questions on this, having worked with cancer cell lines, that I thought I must, add that bit for you.
Thank you.
Yeah. So my question is, so my family members have had AstraZeneca in India, but what I have heard is that AstraZeneca that has been given to them will not be recognized if they come to Australia. And I'm just wondering, if they are both AstraZeneca, then is there any thought like that at all? Because otherwise they would have to come here and retake the vaccine.
The Indian AstraZeneca, which is the co-shield, right? Co-shield
Yes.
is called. Yes, co-shield is approved by WHO, so it's a WHO approved vaccine. So they will accept that and it's in that list of vaccine. I went to a site before this meeting. I've heard some people say, because some of the GPs have refused to accept it or something like that, but it is there in the website, and I think Aurora might be able to post the link, I think, to that site. WHO site. So it is approved. A co-shield is approved by WHO as one of the vaccines, and Australia has accepted any WHO approved vaccine.
Okay. Actually prevent death or long-term COVID in the younger population, because it's there are higher percentages of infection in the younger population.
Your first part of the question, it got because it broke up a bit. I didn't hear the first part here.
Yeah. So my question is, does the vaccine prevent death from COVID or even long COVID or ICU admission or anything like that?
So the death, people who have got vaccinated, there have been 1 or 2 deaths as well. So because they could have other comorbidities as well. So the vaccine, the advantage of the vaccine is your body immune system is kick-started and activating. But unfortunately, if you also have other comorbidities like, heart conditions and all that, and other lung issues and all, it could lead to that. And that's what they've seen even in New South Wales, that there have been vaccinated people who have died, elderly people. So there's no 100%, no vaccine can guarantee that 100%. With long-term COVID, but because vaccinations are much more newer than we know, there's long-term COVID, because we know the virus can target your lungs, your kidneys, your liver, and various other organs and cause damage, which is the scarring and all that. And people subsequently will have problems post-COVID, but there's not much studies to show that vaccination will prevent long COVID, but there is possibility, because the virus doesn't have that amount of, activity, because they're also fighting against your immune system. So they cannot cause much damage in you. So
yeah,
my cat is for some reason jumping up at me.
Yeah, so the virulence, I suspect, is limited.
Much reduced,
Yeah. No, great talk. Thank you so much. It was really informative.
Thank you.
Any other questions? So I think all good. And I would like to ask one question, Mohammed. I was asked that how to protect young children when they are not vaccinated, and as all the adults who are even vaccinated get the chance, has the chance to catch COVID. And in that instance, how would those children who are at home with those adults would be protected?
That's a good question. I think at the moment is what we can try to do is practice COVID safe behavior, and maybe advise our children as well to practice COVID safe behavior. There's no other foolproof mechanism to say a child is not going to get, because sometimes a child could go to a daycare center, pick it up from somebody else or family who's unvaccinated as well. So unless there's a lot of mandatory requirements where, you know, only vaccinated people will be going, but we know even if you're fully vaccinated, you can still get it and you can still pass it on to somebody, because we have seen in some of the aged care facilities in the recent times that it has been some of the staff, although they're fully vaccinated, still somebody got infected, you know, so my advice at this stage is, I think the best is to make sure we talk to the children, I think, and explain the seriousness. I know it's very hard because children will be children. Children will be wanting to be with their friends and all that when they go to school as well. But it is, I think, to advise them as much as possible. If they have any symptoms, that they just tell you so that you can attend to them. Because, but the good thing is we know that children, even if they get it, it's not such a, they don't get a very severe attack. That's the good thing about, not a good thing. I'm not saying a good thing, but it's the positive aspect of, you know, that we know that it's not as bad in children as, that's why the vaccinations are all given to more the older people first than before going to the young people.
Thank you, Mohammed. Thank you. Great explanation. Do we have any more questions? Atajit ji, I can see you smiling. Do you want to add something?
No, I said that he explained very well. He answered all the questions.
Yes. Yes, he did. So if we are all good, then we would like to request you to fill out the end of session survey for us. This survey is coming from ECCV. And then, as we already know, that ECCV is the voice of multicultural Victoria. So we want to gather the knowledge from you so that we can feed back to officials to improve our community. So Rahel, if you can share the survey link in the chat box.
Yeah, it should be in the chat now if everyone can see it.
The survey link is in the chat box, if we all can fill it in. And we are here to support. If you feel any problems to fill it in, then we are here to support you. You can ask questions.
There's lots of sites, pop-up sites that are coming up now over the next few days. There's one in Officer, I think in a Gurdwara. We are starting a pop-up site this Friday, Saturday, Sunday, Monday. So, and then there's also the Dandenong Plaza is at the moment having a site as well for people to get Moderna and Pfizer as well. So, and then there's one in Dupton that will be over the next week. So there's lots of pop-up sites coming. If you go to the website, and we will try and share the sites as well. So encourage people and not to just wait for the, 2 to 3 weeks. There's lots of places you can book, go to a pharmacist and get vaccinated, or a GP. We hear there's a lot of spots available in many of the GPs as well.
Yes, thank you, Mohammed. And I can see Emily, your hand is up.
Hi, everybody. My name's Emily. I'm from the Western Public Health Unit, and thank you for letting me join the meeting. I just was listening to hear what you're worried about and, where the concerns are within this community. Within the West, obviously, we have a really significant proportion of our population with, related to you guys and networked within this group and, influenced by you as community leaders. And so I guess I just wanted to take the chance to see if you had any thoughts around how we can improve our support to your community. If there's things that are really tripping up your community members, if people are finding it really hard to get vaccine appointments, they can't find the information, they want some more details about, COVID and vaccines and things like that. If there's any advice that you have for us, and we can help to shape what we do to make sure that we're really, meeting the needs of the community. And I don't want to hijack the meeting with that question, so maybe I'll put my email in the chat, and if anybody would like to contact me, I'd love to talk to you. I've just started in the role and the public health unit hasn't had the chance yet to do much community engagement. But now that I'm here, we're really dedicated to making sure that you and your communities feel supported. So any advice you have for us, and I can help facilitate it at our end. Thank you.
Thank you, Emily.
Just want to quickly update Shivani. Also, in the Epping Secondary College pop-up site will be open on afternoon Friday, October, until 3rd of October. Is walk-in and booking both.
Wow, that's good to know, Parsi.
So I just put in the chat here.
Yes, thank you so much.
Do you have a tile on that one at all, a social media tile which we can share?
Yeah, I think what we'll do is maybe over the next day or two, we are preparing all the tiles for various pop-up sites.
Yeah.
We'll share them. I think it's across the various regions.